This is a demonstration of Allscripts MyWay for general surgery. Today we're going to demonstrate how Allscripts MyWay can overcome your daily challenges and help you achieve meaningful use. In general surgery practices, most providers are challenged with referring provider follow-up, procedure notes, pre-op and discharge instructions, follow-up visits, and result tracking and interface management. Allscripts MyWay can make your life a lot easier with document generation, procedure notes, education forms, follow-up slider, and common problem palettes. Now let's take a look at how Allscripts MyWay can help meet your needs. Allscripts MyWay is a completely integrated practice management and electronic medical records application. That means you can tell who is scheduled for the day, what their last visit note looks like, and what their balance is on the same database. MyWay is a hosted application. You have instant access to your patient's information, automatic upgrades to your database, and no server maintenance. On the screen, you see the desktop. The desktop can be customized to the user and their role within the practice. On the left are the appointments in time order for the day. The top right is a message center where you can see both internal and external messages. To the bottom right, you see the notes that the provider has begun but not yet completed and which need additional documentation. To schedule an appointment, click on the blue calendar hyperlink, which takes you to the scheduling section. In the scheduling section, you can easily see a day view or select work week and see the 5 days of the week. You can select the appropriate appointment type. The appointment types are built based on the provider and office instruction. Allscripts MyWay is built with the appropriate durations and colors. You can also have more wide-open scheduling as you see at the bottom, in which you can select and add any appointment type to fill those needs. To schedule an appointment, simply select any open spot. Choose the appointment type if you did not select that from your templated list, and then search for the patient. You can search based on patient's last name, first name, medical record, social security number, phone number, or birthday. You can then free text the reason for the patient's visit. In this case, you say that the patient presents for gallbladder removal pre-op. Once you select OK, your patient is now added to the scheduler window as well as the desktop. When Mark arrives for his visit, the front desk is going to select the time, update the status from scheduled to checked in. Move to the Account tab. The Account tab will automatically pull forward the patient's copays from their demographics window. You can go ahead and post their copay. At the bottom, you can post any prior patient balances. The reason that these screens are separate is anything you post up here on the top under Visit Payment will automatically allocate to the E&M line item for today's visit. Anything you post at the bottom will automatically allocate to the patient's oldest balance, so it saves the billing department a lot of time in allocating payments. The front desk's role is generally to collect the copay as well as verify demographics. You can verify the patient's demographics by selecting Patient Information and reviewing to make sure that there are no changes to the patient's address, phone number, and, if applicable, insurance. Once you have reviewed the patient's demographics, you can select OK. Your patient now moves to Checked In and is time-stamped. This is the indication to the nurse that the patient is ready to be taken back to start their exam. The nurse begins the exam by selecting the Open and Create Note icon. The nurse would begin in the Vitals section by manually entering all of the vitals into the appropriate sections or selecting the icon for Welch-Allyn Spot Vital Signs, and Allscripts MyWay will pull the vitals from the device into the appropriate fields of the window. Once the nurse adds the vitals, you move to Chief Complaint. Allscripts MyWay will come pre-built with an appropriate list of complaints. In this case, you say it is a pre-op surgical consult. If you want to modify and add additional content, you can easily select the blue hyperlink and add new symptoms to the list. You can also hide chief complaints by putting check marks next to these items and reorganize them by using your arrows up or down to move items up or down on your list. You can build these based on a provider or based on the entire general surgery practice. Once you're finished making modifications, you move to the HPI. Allscripts MyWay will now guide you to an appropriate list of questions and responses based on the symptom or chief complaint, the reason for visit that you selected. Under the pre-op surgical consult, it's going to ask how this patient was referred. In this case, you select Dr. Ennis. You can build a referring provider list by selecting the blue hyperlink and adding additional content just as you did in the chief complaint section. The procedure to be performed is a cholecystectomy. Under the preoperative instructions, you can point and click through the instructions that you have given the patient and then informed consents. Once you have finished the HPI, the nurse can move to the history section and review the patient's medical, surgical, family, social, med, and drug allergy history. In this case, when you review these items, if there are no changes, you can simply just put a check mark next to these. The initial medical history and surgical history could have been added during the patient's initial office visit to your practice, or could also be added through the patient portal. Under surgical history, if everything remains the same, you add the additional checkmark as well. Family history, identify the specific relationships and then any appropriate diseases, and social history. At the bottom of the screen, you're going to see the number of points that you have charted towards this specific section. This will help you determine what level of E&M code you should bill for at the end of your visit. Under medication history on the left-hand side, you see all of the medications that have been written by this particular provider or practice. On the right-hand side is the retrieved history. This is all the information that you have pulled forward or current medications that this patient is on based on their pharmacy benefits manager. This allows for medication reconciliation. Under drug allergy, you simply select the allergen and then the appropriate reaction. Once the nurse is finished, if there's a specific consent form that the patient needs to sign, you can move over to the attachment slider and you can access all of the scanned consent forms for your practice. In this case, you're just going to pull forward an ABN, and then using your pen tablet, the patient can easily review this consent and sign off. Of course, you can save this consent as a permanent part of the patient's record today. Once the nurse is finished with their part of the exam, they're going to go ahead and save the note and then exit out at the top right. Once you exit out, you are back at the main desktop. The nurse is going to update the status of the patient from checked in to exam room 1. This indicates to the provider that the patient is now ready to be seen. The provider has two options. They can go straight into the chart note where the nurse left off, or you can use the one-page summary icon to give you a brief synopsis of this patient's record. This is similar to thumbing through the patient's chart in the paper world. In this case, you see your patient's active problems or diagnoses, what current medications they are on. You can add additional imaging items here as well, and then it would show you a copy of the visit note as it appears thus far. You also see any appropriate attachments that the patient has signed. At this point, the provider is ready to go ahead and start the chart note and add their pieces of information to the note. You can select the date at the top left, and it takes you back into the full note composer where the nurse left off. The provider can add additional HPI information as well. Using Clinical Decision Support Guidelines on the right-hand side, you can see any information that the nurse may have skipped during their initial exam. Once the provider adds any additional HPI, they can go ahead and move to the Review of Systems, in which you can select one checkbox and Allscripts MyWay pulls forward a group norm review of systems. This review of systems is built based on what the provider generally asks their patients. You then chart by exception, a much faster way to document. You set everything as normal by selecting that check mark, and then you just change any of the items that the patient states that they have had recently. In this case, under Constitutional, if your patient states that everything is normal except for they have recently noticed fatigue, you can just move that one item over to fatigue. Once you finish with the review of systems, you can move to the physical exam and do the same thing by selecting one check mark and pulling everything forward as a group normal physical exam. You then have any exceptions to your rule. You can go into the abdominal exam. In your abdominal exam, you can note in the right upper quadrant that you did notice some rebound tenderness. Allscripts MyWay comes pre-built with the appropriate systems, findings, and descriptions. If you choose to document differently than pointing and clicking, at the very top of the window you can type in this field. Use Dragon voice recognition software or create macros, which are simply just quick notes. Instead of having to type an entire sentence or paragraph, you can select them and move forward. And Allscripts MyWay pulls forward that specific note. Once you document your physical exam, you can move to the diagnosis. You can easily look at Mark Dodd's list and pull forward any chronic conditions. Go to Frequently Used and pull forward any additional diagnoses that this provider does frequently. This would keep track of the patient's top 50 diagnoses, or you could put them in specific categories for ease of use. In this case, you're going to go ahead and select cholecystitis as the patient's diagnosis. Once you choose the diagnosis, Allscripts MyWay is going to remember what you like to do for a patient with that specific disease. This is called a common problem palette. It is remembered by initially diagnosing a patient, moving to the RX screen, and writing appropriate prescriptions by typing those into the drug and adding the SIG. Going to the Services Performed section and selecting what services you want to render today, otherwise known as your CPT codes, you have the same basic categories that you saw in the Diagnosis section. You can then move into the Services Ordered and select what you like to do. This is where you would order any outside services such as MRIs, X-rays, laboratory panels, and then lastly your plan, when you would like to see your patient back, and any specific instructions. It attaches all of those items to your diagnosis. So the next time you diagnose a patient with cholecystitis, it pops up and says this is normally what you like to do for that diagnosis. Rather than going to each of these 4 tabs, you could have easily just selected from this list. You can select Vicodin, and it would write the prescription for Vicodin. It would indicate if there are any duplications in therapy or contraindications based on medical history or allergies. If any of these indications appear, you can continue by selecting Yes or select No and choose a different medication. Under Services Performed, you can select the services you want to render, or you can go to ENM code and ask the system, based on your documentation, what level of visit it would select. In this particular case, Allscripts MyWay indicates that it should appear as a 4. You can verify by selecting a 4 or upcode to a 5. Once you're finished, you select OK. It adds that CPT code to your list. Going to Services Ordered, you can select any services that you would like to order, and when you would like your patient to return, and any instructions. The provider can also add their own attachments or diagrams by going to Attachments and New, and Allscripts MyWay would come pre-built with specific items. But of course, you can also add your own. In this case, you could look at the cholecystectomy diagram for patient educational purposes so that you can explain the procedure to the patient and what they should expect. You can easily save this as part of their record today so that you can reference it later, or simply just use it for instructional purposes. Once you've reviewed any diagram, added any additional information or instructions for the patient, and you're ready to go ahead and complete your exam, you can select Close Note. Allscripts MyWay will indicate if there are any clinical decision support rules that are incomplete that you need to go back and modify, and then it would bring you to your Close Note window. You can determine at this point if your note is incomplete, meaning you need to go back and add any additional documentation, or if your note is completed and ready to proceed through the process. At this point, your super bill will be sent to the billing department with a status of Ready to Review. The prescriptions that you've written would automatically be sent to the pharmacy. The status of your patient now moves from Exam Room 1 to Ready to Discharge. The checkout person now sees that Mark Dodd has moved to a status of Ready to Discharge and is ready to leave. They can click on the checkout icon, in which they can post any additional copayments or patient balances, print selected forms, and even generate documents through Microsoft Word using mail merge fields. The Document Generation section will pull forward appropriate information from your full note composer into this chart note. In this case, you pulled forward the patient's name, their date of birth, and then the opening paragraph. Everything you selected in your full note composer has now pulled forward to add to your note. You can make this note as lengthy as you want by adding the entire physical exam or limiting it to the abnormal exam, in which you would have only pulled forward the abdominal piece. Under the Impression and Plan, Allscripts MyWay pulls forward the diagnosis and what you plan to do, as well as your electronic signature. If there was any additional information, you can go ahead and type and annotate it into your note, and then when you exit out, it saves this as a part of the patient's note for future reference. If you need to schedule a return appointment in 1 week, it will indicate that. It will also indicate if future appointments are already scheduled and if any referrals have been made. Once the front desk has checked the patient out, they select OK, and it now moves your patient to a status of discharged. Once Mark has had the procedure performed and he returns for his office visit, rather than starting from scratch, you can do a follow-up note from this particular date of service. Rather than starting from the beginning, the nurse can go to the follow-up icon at the top of the screen. They can select the date of service in which they want to follow up from, and simply move this visit note from one date of service to the next by selecting the arrow to the right. You then can go into that specific date of service and chart any exceptions. You can say that this is a post-op and add any additional documentation today. It would go ahead and pull forward the same physical exam, the main diagnosis, and simply copies one date to the next. This is a much faster way to document than starting from scratch for each individual visit. Of course, the next time the patient presents for their next follow-up appointment or their next post-op appointment, you could then use this particular date of service as your template. You can also build procedure notes by going to your Services Performed section, and any appropriate CPT code could have a note built behind it. You can add that CPT code and search. Select the icon, and then based on variables that you have selected, you can enter some free text. In this case, you're just going to do a closure of a split wound. Under Location, you document where the wound is located. You say, on the arm. Anything you add at the top will appear in your resulting procedure note below. You say that the size of the laceration was about 5 centimeters. The anesthesia that you chose to use was 2% Lido with epi. The suture size was 4O polypropylene. And there were no complications. Based on these variables, the resulting note would appear below. Back to the main desktop, you have the Message Center here on the right-hand side. These are both internal and external messages. Internal messages can be created by going to New Message and New Call. Selecting the appropriate patient that called, who you'd like to forward this message to, and then any reasons. You can also change the urgency of this message to indicate whether it is routine or urgent. Once you create your message and select OK, it is then forwarded to the appropriate person's inbox. To review this message, you simply select on the Phone Messages filter, open the message, and see here that the patient called regarding an increase in pain and fever which began yesterday. To add an additional note, you would simply just select Add Note, and then using macros you can build a quick list of statements so that instead of having to type, you could easily select the items, adding schedule appointments ASAP and time-stamping it with your information. You can select the envelope pointing to the right to forward your message to another user, or the envelope pointing to the left, indicating you would like to reply back to the user who sent the initial message. Once you select OK, it would then be forwarded to the appropriate party. Refill requests will come electronically from pharmacies, and you could create internal refill requests by going to New Message and selecting New RX Refill. Lab messages would be coming from HL7 interface. You review by selecting the lab, opening the lab that you would like to review, and very similar to how you review them on paper, you would see them here. You see the appropriate value and then the normal minimum and maximum. Anything in red indicates that it is outside of the norm. You can also plot and chart these values by selecting the hyperlinks, and Allscripts MyWay would add them to a grid showing you anything previous and where the patient stands today. You can add additional documentation to these by going to Notes and adding additional information. You can forward any instructions to that patient or an additional user within the practice. You can also create a letter from this field indicating that the lab results were normal and send it to the patient. Imported and scanned documents is a filter identifying any documents that the patient may have had to bring on paper or faxes that the patient has received on paper. You then scan them into the application, assign them to the appropriate patient, and then they're sent to the user. The provider can review these by selecting Imported and Scanned Documents, review these items that were pulled forward, annotate on them using the colors at the top of the window, and then approve these attachments and save them as part of the patient's permanent record. Reporting tools are also important. You can go to Reports and see both your clinical and financial reports on the same window. Reviewing clinical reports, such as patients by diagnosis, you can see how many patients you've diagnosed with cholecystitis in the past year. Any of these reports can also be exported to Microsoft Word, Excel, or PDF files. You can further save any of these reports that you like to automatically generate at specific time intervals. This is great for financial reporting. You can schedule this report to automatically send to your administrators on a daily basis at a specific date and time. Under your stimulus reports, these are the 25 meaningful use criteria with the description, the criteria you need to meet, and where you are faring thus far. Under Allergy List, it shows the percentage of patients having at least one medication allergy or no known allergies recorded. You need to do this 80% of the time. Currently, we've seen 2 patients in the database. You've only done one appropriately, resulting in a score of 50% and a failure. In order to attest for meaningful use, you need to have fewer than 5 failures on this report. Once again, you can schedule this report to automatically run at specific intervals and even narrow it down to find out which patients you have failed to do this for appropriately. Allscripts MyWay not only addresses your daily challenges, but also connects you to 180,000 physician users, 1,500 hospitals, third-party devices and applications, labs and pharmacies across the country, the Allscripts referral network, to patients through the patient portal, to patients' charts remotely, with Allscripts Remote for Apple iPhone, iPod Touch, BlackBerry, or any Windows mobile device. It is your entire healthcare community connected. To request a custom ROI assessment or a personal product demonstration, please call Allscripts at 1-877-EHR-NOW1 or email ehrnow@allscripts.com or visit www.allscripts.com/myway.